If flow is not there, if the data's not there, if patients are bottlenecked at any point of the patient journey, it's a patient safety issue. So it's critically important for clinicians to understand where the patients are in terms of their journey, have visibility of the patient flow, and understand where those bottlenecks are. So as well as having an operational overview and how important that is, it's really, really important for the clinicians to know where in the patient pathway those bottlenecks are. So patient flow challenges start from before admission and go right through to post-discharge. So understanding who's coming to the ED department, what they're coming in for. So if you have an integration with the ambulance CPR, that's the first blocker often. Then within the ED, who's been triaged, who's not been triaged, who are the priority patients that need to be seen, do patients need to move from minors to majors and back? And then when patients, if there is a decision to admit, how long have they been in ED? When do they need to be transferred to the ward? There's another blocker. If a patient's going to be discharged from ED, getting that discharge summary completed so the GP can see that vital information as soon as the patient goes home. Once the patient's admitted, then there's another number of steps that potentially are blockers. I'd say potentially around procedures. So as a patient able to get the procedure in a timely manner, or are they sitting in a bed waiting for a procedure for days at a time when actually there's no other reason for them to be in hospital. And again, at discharge, having all of the conditions, especially for complex patients, understanding everything they need to be able to go home and to be safe so that they're not sitting in bed well, but unable to go home because there isn't medication or an appointment made or a referral made that they need within the home. You can't make a clinical decision without the information in front of you. So having that clinical information visible at a view is absolutely gold. Within Miya, you can see information such as, just at a glance, what a patient's early warning score is, whether they're deteriorating. You can prioritize patients at a glance because you can immediately see what's needed for them, where they are in terms of their journey. Are they a green patient? Are they red in terms of discharge readiness? What scans are they waiting for? Is there any tasks outstanding for them? And as I said, you have a clinical view from a ward perspective, but you can also have your own as a clinician. What are the patients that I'm looking after? What are the needs, the tasks outstanding for me as a pharmacist, as a doctor, or as a nurse? And where do I need to prioritize my time to the worst patient, the sickest patients within the hospital?